good evening to you, Oracle TV family. I love you so much. Thank you so much for always keeping it Oracle TV. We do not take it for granted. For you choosing us, for you putting us as number one priority, we do not take that for granted. And of course, when you see me on air, you know it's that time to get informed. It's that time to unlearn, relearn, of course, learn some things. And being healthy is the most important thing. As we say right here, this is the direct line to your medical doctor. And when I say that is I bring on board specialized doctors. Nenda mpaka natafuta ule ambaye ukudhania utampata. That's why I bring them here so that you can ask one or two things and get clarification on some things. Sababu kuna vitu tumefuata Dr. Google, tumesikiza watu, but now we bring a specialist in such areas ndo uweze kujua ukweli wa mambo. And also tunaweza kosa ku-exhaust everything, and that is why they tell you where you can find them. Ndo uende pale uweze kupata mambo mbili tatu, ujue vile kutaendelea. Of course, I'm your good host, Trevilla Lutta. Tuandamane mpaka tamati, and of course this is the good program, the Health Desk. And of course, karibu sana. Call in your friends, start sharing the live, make people know that we are live so that they can start asking those questions, and of course they get to learn a few things about sex and reproductive health. And not even important because kuna kila mtu inaguzia kila mtu mahali. Kila mtu kuna mahali inakuguzia. Anza kushare hizo links, anza kushare. We are coming to you live on the Oracle Television Network Facebook page and also the YouTube channel, the Oracle Television Network. Please kindly subscribe to the YouTube channel. Click the notification bell and also share and comment as much as possible. We're also coming to you live on our TV. Be kind enough to contact me on 0711-176-006 and I'll be glad to read your comments. I'll be glad to hear where you're coming from and what you're thinking about this, or what clarification you want about the topic that we're discussing today. But before we continue so much, I am not alone in the studio. I have a very important person. I want her to introduce herself, tell you where you can find her so that we can continue. Karibu daktari.
Asante sana. My name is Naomi Muraran, Dr. Naomi Muraran. I work at there's a hospital in Naka Center, Villanova Hospital. Munakaribishwa sana. And feel free to come and ask more questions concerning the same topic we're going to discuss today.
Thank you so much. And of course, thank you for even availing yourself to come.
You.
And before we start our very good topic, you know, this is the time I tell you, this is the best part for you to partner with Oracle TV. And you know we are here because you're always here together with us, and you've made it possible for us to be on air. And that is why we bring you good and quality content. I mean quality content. Unaweza tafuta Dr. Muraranu mkose lakini mimi ndio nimekuletea. That is how I mean quality content. So keep on supporting Oracle TV, keep on pushing that button, keep on bringing on board. Of course, kama pia kuna daktari ambao unataka nimlete on board, feel free to text me on that number and tell me unataka daktari mgani akuje hapa, and I'll be glad to bring the doctor on board. Na pia zile maswali ambazo unaona daktari yako exhaust sana, that is why we usually bring them on board. To partner is very simple. It is running on your screen, 171133, and of course account is Oracle TV. And also there are so many other ways of you partnering with Oracle TV. You can bring in your adverts, of course. You can bring in your shows, your live shows, and so on. And also you can call and tell us, mimi kweli niko na hizi bidhaa but sijui venye nitafanya, and we'll be glad to tell you how you can do that. Of course, tell your friend, tell the other friend how important it is for you to partner with Oracle TV so that you cannot miss this quality information. And you know information is power. When we say it is power, because utakuwa umetoa ile ambao uko unaelewa, and now you understand what is happening on ground, and you'll be acting not just because unajua kuna ule mtu mwenye ana act out of ignorance, but now you'll be having knowledge and you'll be doing and you'll be taking step to the right direction. Of course, a healthy life is that one step you're taking to your future destination. Daktari, now to start us off, what is sexual and reproductive health?
Sexual and reproductive health, I'd say, is one. It starts from a very early age. That is knowing your body.
Okay.
Knowing how to clean your body. It starts from there. And then as you know your body, you know the changes that your body is making. And then you start making boundaries, creating boundaries about your body. And then you come and plan your body. And then now you raise another human being. So it starts from a early age of knowing your body growing, making boundaries about your body, making decisions about your body, and then bringing in the new life.
I've heard you saying planning. Unajua kuna watu wanasema mi bora nikiishi nimeishi. Do we have to plan our bodies?
Yes, we do. We do. We have to plan our bodies. When I say for women,
okay,
when you plan your body, you take care of it better.
Okay.
And for men, who are the heads, basically me, I usually say the men are the heads. They are the ones who lead.
Yeah.
So if you do not come into the planning as the head, the neck cannot plan on its own.
Yeah.
So as the head, you also need to plan this body of yours, and so that you raise a future, a generation that is planned. Even the Bible says it. Hosea 4:6. Whoever wants to build a tower must sit down and put down the cost of that tower. The same thing to the men. If you're planning to raise a family, sit down
and
plan and see the cost. How much is it going to cost you? So basically, it is from knowing your body, understanding your body, seeing the changes, putting boundaries, planning, and raising the next generation.
Wow. And why do you think it is so important, like right now in our country, it is so important that the health of sexual health and reproductive being the priority? Because at the times of our parents, great-grandparents, haiko imetiliwa mkazo sana. But when you see right now, it is like this top priority of our nation right now. Why do you think that is?
Now, what I would say right now, one, the sexually transmitted diseases are on the high level. As in, we are all over the place. We have, and when I say STIs, it doesn't mean HIV only.
Okay.
We have gonorrhea, we have syphilis. The rate at which syphilis, and the worst thing about syphilis, it makes people go mad.
Whoa.
Yes, it does. So you will get syphilis. Syphilis does not have symptoms. Especially for the men. The ladies, at least you will come to tajua uko na syphilis. The men, the only thing we'll discover is kichwa imeruka.
Oh, that is the sign that now we'll say you have syphilis.
Yes. And then there is gonorrhea, and then there is HIV. HIV, right now we are supposed, as a nation, we are supposed to be going down. Lakini, bado tuko chini. Secondly is social media. The reason we want it to be out there, I'd rather, as parents, as guardians, we be the ones telling our kids, telling our teenagers, teaching them on these things, rather than getting to social media and learning about sex and reproductive health.
Yeah.
So what I would tell guardians, parents, aunties, uncles, cousins, when these kids ask questions, they already know them. As low as class 3. These babies know. They ask questions, give them the right answer, and honestly. Where do babies come from?
Tunanunua supermarket.
That is the answer we've been giving all through.
Yeah, watu wengi actually tumenunua supermarket.
Na wewe ukienda Naivas utapata mtoto. Kuna section ya kusema kids only. No.
There's no, and actually you find that it is so much under discussed. Actually, as much as imekuwa kama priority, it is so much under discussed. Is it that people feel ashamed, or rather unaona sasa mtoto wangu nikianza kumwambia tutaanza aje?
Now, what I do personally, let me use an example. I have a class 3 daughter.
Okay.
I let her lead the conversation. Where do you think kids come from? And then she tells me, I'm not, no. You know, they come from 1, 2, 3, 4, 5. Yes.
So you be as honest as possible.
Yes, but you let them lead. Even about their bodies, I ask them, so what do you know? She asked me, Mom, are you bleeding? I'm like, yes, I bleed. All women bleed. So she starts from there. Is it painful? You know, she's learning.
Yeah.
You tell her, umwambie, and then at one point, and also I'll advise parents, as much as we think these kids are young, mine is in class 3 and already knows all these things about bleeding, about having babies, about relationships at class 3.
So don't
underestimate your child and think they're a child. What about that child who's in Form 4? If our class 3 knows those things.
The person is overexposed.
Exactly. So I say, let's be honest, simple and honest answers will lead us in the right direction. Don't think you're exposing your kid. I'd rather you be the one telling them the truth about these things than them going to social media and finding out, or their friends and finding out.
Yeah.
Let them say, my mom said. Because my daughter comes back and say, teacher told us, but you said.
Yeah, there's a firm ground.
You correct them and tell them, I told you, this is what I told you, and this is the truth. Go and tell teacher. Which teacher? Yes, go and tell teacher mom said.
Yeah.
So when you have that firm foundation at a lower levels, they will learn to trust you. They will learn to run back to you in case of anything. They will learn to, in fact, when that time comes, you are the first person they will come to.
Yeah.
They'll tell you, Mom, I want to do 1, 2, 3, 4, 5. And then you'll be like, are you sure? Yes. Things like that.
Oh, but this starts by you being first a friend to them, so that they can be able to even ask these kind of questions.
Yes. These days, parenting changed. How we were raised and how we are raising ours is totally different. As we would not ask such questions. Ile kiboko ungepata. But these ones, I think it's the confidence. I don't know if we were not confident. I'm not sure if we were confident. These ones will just face you life on and just ask you
the tough questions.
You will tell them, let me go to the loo first, I'm coming back. Let me go to the washrooms.
Wow. And what are the most prevalent STIs that you've found in the clinical practice?
The most prevalent, unfortunately, is HIV. HIV is the most prevalent STI. And unfortunately, people are not afraid of HIV. They are afraid of pregnancy.
Yeah.
Pitu inaulizwa kama maziwa ama mkate. Unaona vile unaenda kwa duka useme nisaidie na nipe maziwa? Pitu is the same thing. Nipe pitu. People are afraid of pregnancy more than HIV, which is quite unfortunate, really. So HIV is the most prevalent, and then gonorrhea, and then now syphilis.
Wow. And is there maybe, there are drugs that people are being given, the PEP and the PrEP. Do they really guarantee like 100 they'll be working, or ni Mungu akutangulie?
No, now let me, okay. And now being a pharmaceutical professional, I'll say this. If today we were to diagnose you with HIV, and you start your treatment on time, and you faithfully swallow those drugs, and I keep on saying this, HIV is like diabetes and hypertension, because if today we were to diagnose you with diabetes, forever you're going to swallow those drugs. Same to hypertension. So in the same breath, you continue swallowing those drugs daily. Inafikanga mahali, there's zero detection. We cannot see the virus in the blood, but it is there.
It is there.
It is there. So sometimes, I know we misuse that as medics and say, umepona, ujapona. If you stop the drug, zitarudi. They just hide because the drug is so much in your system, they hide. But if you stop taking the medication, that's when they fully
blow out.
Now, and PrEP. PrEP is the one we take to prevent. You know you're gonna mess, or you're I don't know.
Lack of better words.
Yes. You're a sex worker and you don't want to get infected.
Yeah.
So you take PrEP. So PrEP is also something you take continuously. PrEP is you take continuously. Especially for the ladies, PrEP you have to take continuously, because the day you stop, is the day you get infected. If you are randomly sleeping with everyone, that's when you stop. You will get
infected.
And then there is PEP. PEP is you take after.
After you didn't know
an incident. Something has happened to you, and then you rush to us and tell us this happened to me, and unfortunately, maybe the condom burst, I was raped or something. That's PEP. We give you PEP, and that one you take for 28 days.
Oh, continuously?
Yeah, for 28 days continuously. But for PrEP, you have to take before, and then for men are a bit lucky though. There's something called event-driven PrEP. So let me not advise so much, but there is something called that.
For men.
For men. Unajua unaenda Naivasha sherehe, unakuja tunakupea 3 days before, unaenda Naivasha na unamaliza shughuli zako, unarudi you're okay.
Wow. But why ladies pass through so many things though?
I think it's because, I don't know, honestly, I even asked that question.
Delicate or what?
We are on the receiving end. Unfortunately. So, Sissy, if you know you're going to mess, you have to be continuously, as in that's why I say, and if you love yourself, you'll either use protection, go for testing, or abstain, or be faithful.
Faithful and abstinence.
Yes.
They work hand in.
As in, if you love yourself, kama unajipenda, abstain, be faithful, use protection, or get tested.
Wow. And is mentioning testing, is screening important when you want to know about the STI things? Unajua kuna watu wenye they are like, until I feel like my body is not okay, that is when I'll go for screening for these STIs.
No, screening is very important. The sooner you curb these things, the better for you. As in, the better for you. If you wait for yourself to get sick, trust me, tutashinda kukumanage. So mi huambia mtu, by the time you're coming to hospital, either you're pregnant, these days when you're pregnant, we have to screen you.
Okay.
So umerisk mtoto, umerisk another life.
Yeah.
But if you had screened yourself before, do you think you would have figured that point? I don't think so. And then it ended up being a bitter pregnancy and things like that eventually.
Kitu nini?
Ungekuwa umeprevent ama umejitayarisha psychologically. You're already psychologically, I know this is my position and I want to give birth and this is how I'm going to go about it.
And maybe what will happen for that long-term STIs that are untreated? Umekaa, hiyo STI imekukula. So when you're going, it's very... Hata daktari anakuangalia tu, anashindwa kuambia nini.
One funny thing, nasemanga unaoza. Yes. Unaoza, you end up losing your uterus as a woman, as a man.
Is that serious?
It is that serious. It is. As a man, unapata your apparatus no longer function.
Wow.
Imeoza na ndani, unaoza. But those are infections. Those are infections, especially kitu kama gonorrhea. If you don't come, hiyo ukienda kususu unasikia ati inawasha kidogo, unasema ni kuwasha tu kidogo. Hiyo kuwasha kidogo, come to the hospital.
Wacha waambie kwa hospitali si kitu.
I'd rather you come and be told you're okay than coming there and being told now you have to go for an operation, you have to do what the medication you're being given is way above what you expected. Yeah.
So the earlier you go for screening, the better. And the earlier you know what your body requires. Kwa sababu kuna wale I had sijui nitawaita aje, hawasikiangi uchungu, ni mwili zao ni nzito ama ni ngumu ama nitaita aje. Akisema sasa anasikia uchungu, ejua ako mwisho kabisa.
Sana inakuanga wanaume. And that's why this thing sometimes affects men more than and they are the carriers.
Okay.
Because they really feel the pain, the itch when they're urinating. But us as ladies, the first time you go and urinate, you're feeling itchy.
It is for us. It is haraka.
Instant. Now, this man will continue spreading it without knowing, or you're coming back with recurrent. We treat you, you still come back with recurrent. We treat you, you still come back with recurrent. So clearly, there's a problem somewhere.
So that means everyone is a candidate of screening.
Yes, everyone is a candidate of screening.
So if you're a man out there, ambaye ulikuwa unasema mimi siendi, and talking of that, you find that people, partners, utasikia one partner saying, nyinyi ndio mnakuanga na niwe enda. How important is it for partners to come together for this screening? Sababu moja akikuja.
What I say is going for screening as partners is not lack of trust. It's just being responsible and being wise.
Wow. Hapo kwa wisdom.
Yeah. It's being wise. It is being wise. That's all I say. Because you do not tell me at where we end. How do I go for screening alone? Do I know you? If I see you, do I know you nikikuona hivi na macho? Nimekuscreen?
I know.
Exactly. So tuache kuscreen na macho na museme mimi najua mimi. How do you know niko sawa?
Utajua aje
niko sawa? There is nothing like mimi najijua niko sawa. Let's go for screening and let's go as couples, let's go as partners, let's get screened.
Kila mtu. And of course, which hospitals are accredited to do that? Kwa sababu kuna mwatasema sijui ni gani, niende wapi.
Most government hospitals are accredited.
And maybe daktari to ask, what do you think causes more infertility in Kenya? Apart from these STIs, ni watu wanaleta. Ama mtu anajiletea kwa kutaka.
Sasa we also abuse our family planning methods. We abuse them. Kama mimi naonanga P2, P2 is an emergency pill.
Yeah.
It's supposed to be used only on emergency cases.
But we are having emergency nowadays thrice a week.
I know. If you find it, I say it's not a monthly subscription. It is not. And if you find yourself going to the hospital or the chemist more than twice in a month asking for P2, there's a problem. Sit yourself down and ask yourself, what's your problem? P2 ni ya kukunywa once in a year.
Oh, so if you're taking twice a month, kuna venye umeharibu damage system.
P2, how P2 works, it pushes your ovulation dates. So ukimeza mara mbili kwa siku unajifanyia, what are you doing to your body? How many ovulations do you have in a month? Just one ovulation. So nimemeza nikasukuma. Next week nimeze nisukume. Hiyo wiki ingine nikuje nimeze nisukume. What are you doing to your body?
You're shutting the system down.
Exactly. So kindly, P2 ukiona unaweza endea P2 kwa mwezi. P2 ni ya kukunywa once in a year, twice in a year. Kama umejaribu sana. Because it's an emergency. The other thing, there are family planning methods that I usually think they are semi-permanent. It's not been talked about loudly.
Okay. I was to ask that question.
But we will give it to you, but the reversing the effects of those family planning is very hard. That's why I usually say, usiende tu ukasema nataka hii. Sit down with the doctor.
Let them explain.
Let them tell you the side effects of these things. Not because it's cheap. Unaona ile, the cheapest is this one. You go for it, and then the day you want a baby, unatafuta mtoto unashanga,
what is happening?
What is happening? Ni hiyo family planning zako zenye, you did not sit down with a doctor because it worked for your cousin, it worked for your sister, you decided, I'm gonna do it. So me kindly, infertility sana zinakujanga na hizi, we misuse our family planning methods.
And maybe when should a woman seek for that fertility assessment?
And I usually think when you're ready. Okay, by the time you're thinking of family planning, let's start from when should a woman seek family planning? Why would you want family planning in the first place? If you're not, okay, I'm old age. I still believe in abstinence until you're ready. I know it's a bit
tricky nowadays.
It's a bit tricky nowadays. But if you're looking for family planning, you should also know what your fertility is. Kwa sababu kuja kwanza tujue, why are you seeking family planning? Me, I really want to talk to these youngsters. Why are you seeking for family planning at a young age?
You've not yet started a family.
You've not started a family, and if you want a proper family planning at that age, you don't do it over the counter. Go see a doctor. The doctor is the one who will sit you down and tell you, at this age, you know, there are certain ages. Kuna age yenye mimi nikifika saizi kuna family planning daktari atarecommend and will not regret, is sure. 100% sure anajua wewe Muraran, wewe bado unatafuta mtoto. Lakini kuna hii ingine ya wadogo. We have to be very careful because we want them to
give birth.
Yes. Lakini since you don't want to go and ask the doctor, you're feeling ashamed, you're feeling that like you'll be judged. You decide, well, my friends are doing this, let me also do it. And then by the time you're reaching now marriage age 27, 28, and you're thinking, I need a baby, unatafuta mtoto, 3 years down the line, unakuja kwetu, unatuambia you can't give birth.
Actually, I had someone saying, you should not start using family planning if you've not even given birth to one child. How true is that?
Previously, it used to be so true, but with this generation, I'm so afraid to say that. But it is very true. In fact, if it was the option of the older nurses, the older doctors, they would tell you, don't use family planning before you give birth. But with the generation we are raising right now, I would honestly say, come to hospital, seek medical advice about the kind of family planning that will not affect you in future. These infertility cases we are getting is because we misused this. It was lack of knowledge.
Okay.
Unapata mtoto wa 15 years is on family planning. 18 years is on family planning.
Yeah.
What do they know? They don't even know. They don't even ask their parents. They do it out of peer pressure. So they are doing these family planning things out of lack of knowledge. Now you start at 15. When you're 25 and you want a baby, you can't give up birth. And because you did not even tell your parents, your parents think it's just infertility issues. Tunakupeleka hakuna hospitali ya twende mpaka kienyeji, tunaendea zote.
So the best thing is just avoiding.
And if you cannot avoid, seek professional care. Advice. Kuja tu, uliza daktari, I'm 15 years old. They will not judge you, by the way. Kuna age, from 16 you're allowed to make your own decisions in Kenya. Apparently.
Wow.
Without your parents when it comes to the medical field. So you come, and if the consent is there, tunakupea tu.
Unasikia wanaongea kama mama, roho iko imeina.
16 years unataka family planning. I need at 16.
And maybe because when you talk about family planning, people think that it's a woman thing alone.
Oh, no, it's not a woman thing. In fact, I'm proud of the men who walk into the hospital and help their wives.
Wow. Kuna wanaume wanakujanga?
Wanakuja. And also family planning is not also for only family planning, as you say, to prevent pregnancies.
Yeah.
It's also to balance your hormones.
So you can take family planning to balance the hormones.
Kuna wale watu and you're bleeding so much and you don't see your periods. You have hormonal imbalance. We will give you family planning to balance your hormones.
Oh.
Yes.
Because majority of people, ever tell me down there, when we are being told about family planning, we all think it's just about no pregnancy.
We also give to balance hormones. Hata umeshindwa ku give birth.
Oh, so
we will put you on family planning for 3 months to balance your hormones. And then we see if you can give birth.
Wow. Now at least you've learned something.
Yes.
You know now family planning is not just for women, and also it's not just for pregnancy prevention. It's also to balance the hormones also to make you get
Imagine.
pregnant.
Yes, it is true.
And maybe a contraceptive safe for long-term use. Are they very safe?
Yes, no, most of them are safe. They're safe contraceptives. Being an elderly woman now, I can say they're safe. Yeah, they are safe. And one funny thing, the safe ones are the ones not liked most. Yes.
Wow, that's amazing.
Yeah, most people have handled, nikiwaambia, why don't you use this? They're like, nilisikia, we are very good at myths. Nilisikia inafanya hivi.
Inafanya hivi.
Nilisikia ukiweka inafanya nini. Ukifanya nini unafanya nini. But I say also, yeah, those myths might be true, but come. These things are individual. What it does to you does not do it to me.
People have different genes and hormones.
Our genetics are very different. So ukiamba ulisikia, I'm asking myself, haya sawa, so what do you want us to do?
What do you want us to do?
And then the one we give you is not so safe, and then you're very comfortable with it.
Actually, somebody said, I asked, if people are married, is it safe for a person to go alone, or rather going both of them to know what will work for both of them as a couple?
Now, men are the difficult ones when it comes to family planning, unfortunately. So if you get a man who can sit down with you and hear the options that are there, ushukuru Mungu.
Wow. Kidogo nika
Unashukuru.
tutie bidii. Tieni bidii for what is happening, but you knowing how to handle yourself. And remember, daktari, when you're starting, daktari said, you plan also your life, you plan your body. It's not something that you just wake up and you're like, this is what is happening. Like, you have grown up, these are the things that are happening, and you understand that there's something, kuna venye hii mwili yangu inaendelea, if I do not take good direction, there are things that will not go on well. And there are actually STIs that makes men dysfunctional.
Yes. So after your infertility, who tells you it is you who's infertile? It might be the man. Lakini tushaekelea wanawake. Kila kitu tumewewa ni wanawake. Because they will not even go to the clinic when they are infertile. Kikiumana sana sasa ndio
Umefika mwisho.
And then the problem, I'll tell this to the men. Having several partners is not a fertility test. Unaona bibi yako hajaza, unasema acha nishike Naomi, acha nishike Grace. So you're testing with everyone if you're fertile. In the process unaleta STIs hapo. Unasema bibi yangu ndiye ndio ako na shida, acha niende huko. Unaenda huko, and men do that, unfortunately. So wakisha try around 10 women who are not giving birth, that's when they discover the problem might be
me.
Yes.
After now they have collected.
Yes. Wamefanya statistics, but from the word go, they will not even think about themselves. They will not think maybe my wife is not giving birth because of me. They will think, huyu ameabort mara mingi, huyu ametumia family planning, they will blame the woman. What if that time umejaribu, and then the first thing is thinking, why could the problem be me?
Be me.
Yes.
Also, it comes to that point when you come back to self-realization and say, we are in this together.
Yes.
Let's work out what will we do.
And I want to ask the men to come to that self-realization very early before they destroy their marriages. Most of the time, they've treated the woman so badly, blamed them. They've made the in-laws hate her, only to discover I'm the problem.
Later, when you cannot mend things.
Yes.
And maybe what are the preventive practices that people should do to avoid these STIs and all that?
And I have said faithfulness, tafadhali. Let's be faithful. The youngsters abstain. Honestly, it's not uncool not to. It is wise to abstain. wisdom, as we say. Whoever lacks wisdom, let them ask from God, and it will be granted to them. Abstinence is wisdom. And if you cannot avoid it, protection, get tested.
Go to the hospital. And the key thing is make sure you're getting screened. How many times a month or a year?
After ideally it's after every 3 months. But if you do it twice in a year, well and good.
If it is thrice a year, that means after quarterly.
Quarterly, 4 times in a year.
4 times in a year.
Sasa kikiharibika sana kuja mara mbili. Sasa zile unajiamini ukuje mara mbili. Lakini go for every 3 months. And then the other thing is, why can't youngsters basically just abstain? It is safe, it's peace of mind. You don't have scares, you don't have... Si ati ukishikwa na homa unaanza kufikiria guy.
I had someone saying, I think we were back in university, they were born sexually active. Is there something like that?
There is nothing like that. At you're born sexual, there is nothing like that. How can you be born sexually active?
They were very confident, by the way. And they are explaining they cannot survive.
No. It's just an addiction. Okay, so there's also sex addicts, by the way.
But it started somewhere.
It started somewhere. You cannot be born sexually active.
So, you know, back then I totally believed, because when I didn't have that knowledge, and then we were like, hey, how can God create someone sexually active? But now, as I continue, that is when I realized, kumbe, this is something that...
And they get addicted, and because they cannot explain their addiction, they say, it's like people saying, if I don't drink, I can't operate on you.
Yeah.
Did you start the operation, daktari, while you were drinking? When you're in school, so ulikuwa unafanyanga operation sober. So it's an addiction, and then they are looking for an excuse for their addiction. Yes.
Oh, so that I can show ile kutoa lock asubuhi ndo aweze function vizuri.
The same thing. You are addicted to sex, and because you cannot explain your addiction, you're saying you were born sexually active. Yes.
It's just a simple excuse people give. And maybe when should men seek medical evaluation for reproductive concerns?
And when should they start?
When should they seek?
Once you have, I usually say, once you decide you want to have a family. Hapo. You should also think about your reproductive health as a man. You want a baby? How is my reproductive health? Okay. Are you sexually active? How is my reproductive health? Because as much as we say these things, men take their reproductive health like a walkover. They don't even know there's something called reproductive health for men. They just assume. And unfortunately, most of our marriages or come we stays start with the lady saying, I'm pregnant. Then unaambiwa, okay, sawa, kuja basi tuishi pamoja. As in, previously, okay, I'm very old. Previously, there was something called marriage counseling. You sit down. Na ilikuwa nafanywa for almost 3 months or 6 months.
Ndio
courtship. Kulikuwa na kitu inaitwa courtship. Ukikatiwa muna court under the supervision of a pastor. And that's when you are being taught about your reproductive health. In fact, nakumbuka kulikuwa munaenda mpaka hosi munatestiwa. Munaleta results kanisani. Nafanyiwa harusi. I'm sorry.
But you know, nowadays, when you come to Gen Z, they feel like they don't want people to get into their life so much. Like me coming to tell you about my reproductive health, like you've overstepped.
No, a medic does not overstep. Go to a medic. Them days we used to go to the church.
Okay.
They might feel that the church is overstepping. But since you do not want the church to come in, go to a medic.
To a medic.
A medic will give you a professional view, give you the steps to take. If this is, you're trying to settle down, come for screening, do 1 or 2 tests. Go ahead. This is the lady you want to settle down with them. Yes.
And actually, do hormonal imbalances affect libido?
Yeah, they do. Very much. That's why when I said we give hata hizo dawa za family planning, ukikuja na low libido, tutakupea tu bado hizo. Na ina affect. Sasa unaona hata hizi magonjwa. They also affect paka libido.
Wow.
Inafika point where sex is not even part of you.
Na sikupenda.
You find young men coming for Viagra in the hospital. You're in your 20s. Na maguka wa 60s awatumi.
But you're using it. Uko kulioza, awaraushi, auna ene, you're just there. Like, is there a way to reverse it?
If it is early treatment is the only option.
Wow. So hakuna, like, there's no other way of us telling you, go to the doctor. Like, there's no other polite way of saying go to the doctor. Please, make it an effort. Unaona kwa ile list yako umeandika ya this year. You say this year I want this. Please put hapo kwa your list doctor's appointment. Quarterly. Unaenda tu unaangalia inaisha April, hapo kando unaandika doctor's appointment. Hivyo. And you'll be saving a lot. Like, you'll be saving so much. Ukiangalia there's a certain book nilipatiwa, and this book was saying, kindly check on your frequent routines and see what you need to upgrade and how it will help you save. So if you go and see a doctor, it will actually save you the cure yenye ungefanya pale mbele, and you lose actually a lot more. Yenye tuseme saizi utanulia tu chakula, healthy diet, and you're good to go. Few exercise, kutembea, and you're good to go. So if it needs, come, please andika pale after 3 months, doctor's appointment. After another 3 months, doctor's appointment. If you see it is too much, just say after 6 months, there's a doctor's appointment. Then after other 6 months, you see a doctor. You're not going because you're sick. You're going to know how healthy you are, because that is your first wealth. When you're healthy, that is your very, very fast health that you have. Continue partnering with Oracle TV, and of course keep on your questions coming on 0711 176006. Kama kuna kitu unasikia, by the way, tujaguzia because tunaongelea sexual and reproductive health, na leo kama tumeguzia sana kwa family planning because we are in the season of love. And you need to be loved well and know which one will work for you. And for young people, we have agreed that emergency pills, please don't be running to them. At least go to the doctor and explain what will be working for you, because even hard for that pill to kuisha kwa system yako, it takes a year. So if you continue taking them, imagine to have miaka ngapi ndio ikue cleared out from your system. So partner with us, 171133, account Oracle TV, and we'll be glad to bring in more people on board, more doctors on board to enlighten you and remove the myths and give you the facts of what is happening. We know you've been Googling a lot, but it's not bad, but at least have the specialist on that area. Ndio siku unajiua mwenyewe, unaona kitu moja unasikia, hi, this is it. Please see the doctor. Simbali, if you're in Nakuru, Naka is the place to go. Just go there and you'll see the doctor, and atakuexplainia moja mbili tatu, and trust me, utatoka hapo ukiwa una smile. That is the best thing. Your health is why we are here. So keep those questions coming. And of course, follow our comment section kwa Facebook, jam the Facebook with your questions and YouTube with your questions, so daktari aweze kukuelezea zaidi na zaidi kile ambacho daktari tukimalizia what is that unasikia hii nisipoambia watu sitatoka kama moyo wangu iko sawa.
Ndasema Valentine is not an emergency. unaona vile umepanga location, outfit, pia upange maisha yako
vile kutakuwa.
Na sex is not a gift.
Kuna mwenye hiyo ndio gift amebeba this time round.
Sex is not a gift. Valentine is not an emergency. There is nothing like it just happened.
I wasn't prepared for this.
Yeah, no. There is nothing like that.
Love took it over.
No, there is nothing like that. Love is patient, love is kind. Yes, so if they really love you, they'll be patient.
They wait.
Yes, they will wait.
Tuko pale kwa abstinence, watu wa Mungu. Abstinence. If it is possible, abstain until the godly way. It matters a lot, and there is respect that comes from that, actually. So, as we are ending, there's this one thing. And sexual and reproductive health is not just about reproduction. It's about overall physical, emotional, and social well-being. Early screening, accurate information, and professional care saves lives.
Very true.
They save lives. So make sure it is physical. Kwa sababu ukiwa umepata syphilis, situ ninime, pia your mental itakuwa sawa. Your mental state will not be okay. Kuna venye physically tu hautakuwa sawa. And we need you full working 100% sober. So make sure that you are getting checked. You love yourself so much. I love it when the Bible says, love your neighbor as you love yourself. So if you do not love yourself, you can't even know how to love your neighbor. And you taking care of yourself first is the first thing that shows that you love yourself. Kama kuna mahali ulikuwa, and kuna wale watu umepitia so many traumas, that is, we're not saying that it is okay, but yes, it happened, but it's time to move on. It's time to tell God, these are the things that are happening. Now let me go see the doctor. Let me know how I will walk this journey, how I will go. Maybe daktari, what do you have for those people who maybe they were raped, they didn't plan it. They were raped, and during that they find out that they have syphilis, they have gonorrhea, they have HIV. What will you tell them? Because I've met a lot of them in the AGMs. Now, wanasema, what is the need even of going? My life is actually over.
One funny thing, your life is not over. It is not over. And you're not alone. And this journey we can walk together mpaka ushangae. Why was I giving up along the way? As I said, the day you discover, if you have HIV, the day you discover that, syphilis and gonorrhea, they're treatable.
Yeah.
If early detected, especially for syphilis, if you are early detected, you're to not treat haraka sana. Inaisha. For HIV, unaona vile watu wanameza dawa zao za diabetes na hypertension. I usually say when you're lucky. HIV is a bit lucky because they swallow once in a day. Diabetes utameza asubuhi na jioni. Hypertension asubuhi na jioni. Na ni tembe 2 ama 3. Hii ni katembe moja tu kila siku jioni. So, why can't you work that journey with your head high? Fortunately, being in the medical field, I've seen people who are positive and they're doing very well.
Wow.
Acceptance is the key. Once you have accepted that I'm HIV positive, come for your medication regularly. These days, the government is even very lenient. You're given up to medication for 3 months.
Wow.
So si zile mainzi zenye ulikuwa nakuja clinic you're stigmatized. Unasema hao ni watu wa clinic. Hakuna kitu kama hiyo siku hizi. No one knows. When you walk into the hospital, no one knows wewe umekuja nini. Siku hizi dawa zinapeanwa mpaka kwa chemists. Yes, it's being rolled out. I think this year by March.
Unakuja kwa chemist unachukua. Unakuja
kwa chemist, the nearest chemist that is hapo kwenu hapo. You choose a chemist hapo penye unaona your privacy is okay, you picking your drugs. They will liaise with the Ministry of Health on how you pick your drugs.
Wow.
End of story. So, and if you're raped or an incident happened, you found yourself with these STIs, it's not the end of the world.
Wow.
Yes.
Just keep hope alive. and know that God always has a purpose for you, and He will do even much better. Sometimes some things happen, and later on in life you say, God, I've heard other people saying, God, thank you, because it is a testimony now. They are bringing other people up. But I don't know how that came up, but kama ni wewe una feel hivyo, please. Life is not over. Seek a medical attention where you feel okay, or go with somebody who you feel you can trust so much, and they'll be there for you. Before we end, continue partnering with Oracle TV. Account number is 171133. And of course, make sure when you're partnering. Nimekwambia hii ni ile yenye unajua is anything ni shamba. Ukienda kupanda mahali au shindangi umeenda umechimba, but you always hope there's something that will come out there. And because you know there's a good seed that you've planted there, mahindi, by 3 months itatoa this quality seed. That is what I say. And when you do that, please put a demand on it. Tell God, I want my daughter to be a doctor, or my son, and this is what I am doing. Later in life, let them yield the fruits. Even me, tulisema hapa si ti watoto tu wetu, even wewe mwenyewe uanze kukula hiyo matunda. Tulikata ile notion ya watu wengine wanapata, pia wewe wenye ulileba, pia wewe furahia jasho yako, usikie uzuri wake. Daktari, what is your parting shot as we are ending?
My parting shot is afya yetu nguvu yetu.
Wow. Afya yetu nguvu yetu. Imagine, that is a powerful statement. Like your health is your strength. Wow. Sitaongeza kitu, sitapunguza. Thank you so much for joining us. Thank you so much for being here together with us. Kuanzia ile masaa tulianza mpaka saizi tunamalizia. And of course, zile maswali zimekuja. Trust you, we will keep the doctor coming so that tumuulize hizo maswali pia aweze kuwajibu, aweze kufafanua zaidi. And if there is something else you want us to talk about, please, this is that year. You comment, tell us what question you have, and trust you me, I'll do the due diligence. I'll look for the doctor, I'll bring the doctor on board, and they will be answering your questions. Na kama kuna ile further clarifications you want one-on-one, you can also get them hapo, ama tuulize where you will get them on 0711176006, and we'll be so much glad to direct you to where they are. Bora tu tuambie daktari mgani na unataka kuelezewa nini. Trust you me, we are here because of you. Remember, this is the Health Desk, your direct line to your medical doctor, with me, Trevilla Lutta. Till next time, God bless you.